similar to a heart catheterization. The two main tests that are frequently done and that we frequently will do prior to this surgery is a CAT scan, which we're looking at pictures over here. And a CAT scan basically is the #1 test we use, and in fact, based on that test, we can typically decide whether someone's a candidate for this type of procedure or not. And if they are a candidate, oftentimes we will do the arteriogram to help define the specifics of the anatomy. There are a whole host of anatomical constraints in terms of when the devices can be used. I'm not sure we need to go through all those. It's a rather complicated issue, and the truth is it's an issue that's probably going to change more as time goes by. This is a very evolving technology. So the sort of the crux of what's the reason for doing this, one of the things that has been looked at is the potential benefit in terms of offering this procedure to patients who we would probably have been very, very concerned about operating on through a traditional approach. In other words, a major abdominal incision. For people who are healthy, for people who are a little bit at the younger spectrum of the age of people who get this, the old-fashioned operation is a great operation. But for someone a little bit older, or someone who's got heart problems, kidney problems, maybe lung problems, then this operation can potentially allow us to treat an aneurysm and hopefully prolong someone's life in a case where we might otherwise have been steered away from recommended surgery. The other thing is that one of the things that studies have consistently shown over the last 2 years or so, and our experience is actually very similar to that, and that is that the morbidity of the operation seems to be consistently less than the morbidity of the old-fashioned traditional operation. What that means is that the risk of problems that may be associated with major surgeries, such as heart problems, lung problems such as pneumonia, kidney problems, are less with the stent graft approach, because you're not opening the abdomen and you're exposing only the groins as opposed to the abdomen. Blood loss across the board is reduced with the stent graft approach as well. The hospital stay is definitely shorter. We are, for the most part, most of our patients have gone home on average about the second post-operative day. Some have gone home as soon as the day after surgery. The old-fashioned operation has about a week in the hospital average, but there was always some patients who might have had problems who were in 10 days or so. So this newer operation definitely shortens your hospital stay, and this is really